Alright, in this video, we'll be discussing the fungus Sporothrix shankii and the subcutaneous infection that it causes, which is known as sporotrichosis. Sporothrix is classically contracted by cuts from the thorns of a rose bush, which is how it got the name rose gardener's disease. We're going to keep with this theme for our sketch and use a gardener working in a rose garden as a setting for our scene. And we've appropriately titled this one, Shanked by a Rose. So let's get going. We'll start by drawing out our garden. Sporothrix is not just found on rose thorns, but is also found on tree bark, bushes, and plants. So we'll draw in some nice greenery. It's also a dimorphic fungus, so we'll use our recurring symbol for dimorphism, the dimorphic butterfly. For once, this really actually works well with the scene. Butterflies belong in the garden. We'll also draw in some branching rose stems to represent the branching hyphae of Sporothrix that you would see if you look at cultures grown at 25 degrees Celsius. Next, we'll draw the roses, which are more like rosebuds, really. And these rosebuds are supposed to represent, of course, rose gardener's disease, and we chose to make them look like buds to represent the cigar-shaped yeast that you would see under a microscope. So why rosebuds to represent cigars? Well, Rosebud, of course, was the newspaper tycoon's dying word in Citizen Kane, which is directed by Orson Welles, who is well known for smoking a tobacco pipe, which is similar to a cigar. Just kidding. We'll represent cigar-shaped yeast with a cigar, and give it to our gardener to puff away while she's gardening. Okay, on to transmission. As I mentioned in the beginning, Sporothrix is most commonly introduced into the skin by physical trauma, like when a thorn from a rose bush cuts into the skin. This can result in a local pustule or ulcer at the site of trauma. Further nodules can then develop in an ascending pattern along the path of draining lymphatics. So we'll draw in some vines ascending up the brick walls in the background to represent this ascending infection. Notice how we've drawn these thorny vines of the rosebush wrapping around the gardener's arm? This is to represent how the cutaneous infection tracks up the lymphatics. Really, I think this is a great tool to think of sporotrichosis. If you think of the lymphatics as a network of vines throughout the body, the rosebuds sprouting up along the vines really paint a nice picture of what sporotrichosis looks like. The red bulbs on the vines should remind you of the red bumps that appear on the skin following the infection. Now, to confirm the clinical diagnosis of sporotrichosis, culture is the gold standard. You can also do a biopsy, and you'll see granulomas consisting of histiocytes, multinucleated giant cells, and of course, cigar-shaped budding yeasts. So how do we actually treat lymphocutaneous sporotrichosis? Well, itraconazole is the drug of choice. We'll represent itraconazole, or itraconazole, with our recurring symbol of, that's right, some pine cones. We'll draw a few pine cones in the tree and some on the ground. These pine cones seem to work their way in every one of our fungal videos. So it seems like you really can't go wrong if you're guessing a conazole for a fungal infection. Another form of treatment that was really standard of care up until the 90s was a saturated solution of potassium iodide. Even though this really isn't used anymore, it may come up on tests, but more importantly, it'll give you something awesome to talk about on dates or cocktail parties. Anyway, we'll include potassium iodide by having the gardener spraying a solution of potassium iodide pesticide, which, interestingly, are actually ingredients in pesticides. And that's another cocktail conversation for you. No extra charge. Anyway, that's all for Sporothrix shankii. Not too much to remember. Hopefully we've given you a good way to bring it all together. Just be able to recognize that ascending lymphadenitis, and of course the cigar-shaped yeast. We'll see you next time.